So before I introduce our only speaker in this session, I want you to get thinking. So as you can see, the focus of this session is reflections and what's next. So I want you to start thinking about your questions, your thoughts, your reflections for the panel. So before we come to the full panel, I'm delighted to introduce Dr. Fiona McElligott. Fiona is a consultant in paediatric palliative medicine in CHI in Temple Street, as you've heard, and in the Rotunda Hospital. But she's also a board member of Laura Lynn's Children's Hospice, as something that I know is very committed to. So Fiona is going to give us a short presentation to share some of those reflections again to get us thinking. So Fiona, over to you.
You'd be glad to know I've started my own stopwatch. Thanks for inviting me to reflect. You've played a dangerous game asking me to reflect. I'm from Kerry and I meander and I like to tell stories. But that is because this is all about the stories and it's all about the children. And I don't know if everyone here knows, but this seismic shift happens every July in healthcare, where medical students graduate becoming interns, interns become SHOs, SHOs become regs come out as consultants, people go off on fellowships. Nobody takes annual leave the first week in July. And I recommend, where possible, maintaining your health through the first week of July every year. But 20 years ago this July, I started my first job in paediatrics. And on my very first day, on the very first morning, a tiny, tiny preterm baby was born. And that little person went through a lot in their first year of life. They were in the neonatal intensive care unit and the special care baby unit for 5 months, which was where I was for the first 6 months of my paediatric life, if you like. And every morning when I arrived at work, you know, it was really impactful for us that a baby had been born the morning we started. So every morning, I would go in and say hello to this baby. And you'll be glad to hear that I had little to do with the baby's care because the baby was in intensive care and I was myself an infant. But over time, you know, we sort of journeyed along. I journeyed along with this baby. I was very new and I was very junior, and so it wasn't until this little person got to the special care baby unit that I was able to get involved in care delivery. So from the off, I promoted this baby to being the first baby that I would see every day. And I'd like to say that was to improve I'm sure it was lovely for the baby to see the same person, or not the same face every morning, but it was a really amazing start to my day. So every day, the two of us would have this time in the morning together. And this little tiny person, you know, was receiving life-saving and life-changing care through all that time. And all the while, I was learning about the kind of doctor that I wanted to be. So as I was preparing for today, reading through again the findings of this phenomenal body of work, but with the lens of this launch, I was thinking about that little person, n=1. And I know that very tiny special baby would be in these numbers if these numbers were about that time. This data matters. It matters to every one of the children in Ireland with life-limiting conditions. It is the first time that we have had high quality evidence with prevalence and health utilisation rates. So about the data reveals, as we've heard, that the highest prevalence is in the under ones. So Irish infants, like their global counterparts, and no different to the baby that still inspires me so much, requires us to focus on the further development of perinatal and neonatal palliative care provision and to support our maternity and neonatal units around the country. Our colleagues, Professor Keelan Donoghue and Dr. Archana Soman, who is here, are leading out on national guidelines to underpin perinatal and neonatal palliative care, and this data consolidates this effort, and these data can influence care delivery in a very real way. And we can see from the data that those infants, children and young people of Ireland with life-limiting conditions are spending more time in hospital than their non-life limited counterparts. This highlights the importance of making sure that every day is a good day. Every day is as good as it can be, and we're all here because we have a goal of improving the lives of these young people. When we are talking about this, we need to think about every day of those lives. They can't be waiting for tomorrow. They shouldn't have to wait until they feel better. It's fitting that we are here during Children's Hospice Week, alongside our friends in Laura Lynn, Ireland's Children's Hospice Service provider, and sharing a desire to make every minute matter and every child count. And so the data directs us to also consider, in paediatrics we call it the other extreme, transition. And we recognise there are very particular needs of adolescents and young adults. We can now plan and describe and deliver on a model of care sincerely because we have the sincerity that this rigorous data gives us. We have heard many times today that the launch is timely in light of the revision of the Children's Palliative Care Policy, which we welcome and appreciate within this programme for government. The next step, or rather the first step, as we know, for anything is often the hardest step. But this data is meaningful and it is the first step to enriching policy, to enriching the quality and substance to care delivery for children and young people with life-limiting conditions in Ireland. And so this data is the first step to creating change. Alongside the next steps of policy, as we've just heard, we must now also seek to address the gaps. I think the phrase is, the first step is to admit you have a problem. So we found the problem. We can see the gaps. We've also found a lot of information, but there are gaps and we have more work to do. We need to push forwards by improving national data so that we can link hospital and community primary care. We need this because the children need the gaps sorted. We are still on a course of discovery. And what about the children that we don't know about? We need to know who they are so that we can meet their needs. And we need to know their needs so that we can meet their needs. We need to consider how these children traverse not just the health system so that the health system works for them, but also ensures a continuum of their everyday life through community, into school, into the home. Sam mentioned earlier that this is a group with the highest resource use in hospital. And I think we know each of these children has high resource utilisation. We know that they have high resource needs. It's not a criticism, it's a fact. But how much more? And how can we further define that? How can we look at the resource needs outside of the hospital setting? So there is more work to do. So when I was doing my SHO job in what is now called the University Hospital Maternity of Limerick, I told my friend that if I had stayed in adult medicine, that I would have liked to do palliative care. But I had this I'd been bitten by this peds bug and I wanted to do some pediatrics. And so she said to me, why don't you do peds palliative care? And I said, I don't think it's a thing. True story. But little did I know that, Maeve O'Reilly was already trailblazing this in Dublin alongside Marie Toomey and with support of the Irish Hospice Foundation and policymakers. I didn't know Mary Devons. I didn't know that her training, her specialist training was already in hand, and also that she was collecting the data that has in some way led us to where we are today. But 20 years on, we can see from this information that we've heard today, from these data that we've gathered, that palliative care is integral to all paediatric care across all disciplines, but also across all settings. We can shape undergraduate, postgraduate education. We can shape education within education so that the young people's needs can be met where they want to be, not where we demand that they go to meet them. Lorna highlighted the importance not just of survival, but of thriving in life. And I really like that word, thriving. And it's core to what we're trying to achieve. So we need to take particular care and we need to pay particular attention to consider the children and young people from all areas, from all backgrounds, of all colours, and of all areas on the social scale and within areas of social deprivation. The dangerous part was when Samantha asked me to reflect on the process of being part of this group. Dangerous for me because of my, meandering storytelling abilities or inabilities. But this research reflects a process in which researchers with their honed skills, strategists, clinicians, across general and specialist services, and most importantly, patient representatives, work together scientifically and robustly to answer the question, how many children are there? It's safe to say that the rigour with which this research was conducted and delivered is the beginning of the true big picture. And for these children as individuals and as a group, the big picture matters. That picture has a child in its very centre, and rather than the tranquility that we sometimes, life is romanticised, that if you have a life-limiting condition, life should be tranquil and peaceful, and I'm not a massive fan of the word peacefulness, but anyways, we can see that actually living with a life-limiting condition, it's noisy and it's busy and it has the potential to within that also be the noisy, busy life that a child must lead, that a young person must have as they traverse their course of their life, whether that is a long one or a short one. So it's busy and it's noisy, and hopefully this data and definitely this process has taught us that actually with the right balance of living and the right balance of all the bits and pieces that life becomes and that becomes life, perhaps we can seek to ensure that these children and young people are living their right balance of their life, hopefully their best life, with little maybe bubbles of healthcare fizzing through that can be positive, happy and manageable parts of their lives. Thank you.